So if you're in a support role, you know that some days, well, they throw decisions at you that are anything but simple. Today, we're going to build a practical guide, a toolkit for handling those tough ethical calls with a bit more confidence and a lot more clarity. Let's dive in. Okay, let's jump right into a situation that's incredibly common and incredibly tough. Imagine this. A client you're caring for just refuses to take their medication. Your training, your experience, your gut, everything is screaming that this is a bad idea, that it could really harm their health. So, what do you do? This is exactly the kind of moment where having a solid ethical framework isn't just nice to have, it's absolutely essential. Because, look, our gut feelings, they're important. Our personal beliefs, totally valid. But when you're acting in a professional role, you need something more. You need a reliable toolkit, a structured way of thinking that gets you beyond that initial reaction to make the best professional decision you can. And the first tool in that kit is understanding the huge difference between morals and ethics. Think of it like this. Your morals are your personal, internal compass. They're shaped by your family, your culture, your whole life story. But ethics? That's the professional guidebook. It's the set of external rules and standards that everyone in your profession agrees to follow. And when you're on the clock, that guidebook is your North Star. This is exactly why that guidebook, that code of ethics, is so critical. It's not there to tie your hands. It's there to protect everyone. It gives you clear guidelines, it safeguards your clients' rights and their trust in you, and it makes sure you're accountable. Really, it's the foundation for the trust that makes any kind of quality care even possible. All right, so let's open up this toolkit and see what's inside. We've got 6 core principles that are going to act as your compass when you're lost in an ethical fog. Think of them as the rules of the road for healthcare. First up, and this is a big one, autonomy. This is the bedrock idea that every client has the right to make their own choices, whether it's something small, like what they want to eat for lunch, or something big, like whether or not to take their medication. This one speaks directly to that scenario we started with, right? But then you've got this one, beneficence. This is our duty to do good, to act in the client's best interest. It's probably why you got into this work in the first place, to help people, to make things better for them. And you can probably already feel the friction between these two principles. And there it is. That's the heart of our problem. The client's right to choose, their autonomy, is slamming right up against our duty to help and protect them, our beneficence. This is the textbook definition of an ethical dilemma, when two of your core principles are pointing you in completely opposite directions. Now, the other principles are here to help us find some balance. First, you've got non-maleficence. It's basically the golden rule of healthcare. First, do no harm. It means making sure your actions, like using a proper lifting technique, are always aimed at keeping people safe. Next up is justice, and that one's all about fairness. It's the commitment to giving every single person the same high standard of care, no matter who they are, where they come from, or what their situation is. No exceptions. Then we have fidelity, which really just boils down to being trustworthy. It's about keeping your word. When you say you're going to do something for a client, you follow through. It's about being someone they can truly rely on. And last but not least, veracity. Simply put, this means being truthful. Your honesty, especially when you're reporting something to a supervisor or the rest of the team, is absolutely critical. It's the glue that holds safe, effective care together. Okay, so we have our principles, our rules of the road. But how do we actually use them when we're in the middle of a stressful situation? That is where this playbook comes in handy. It's a clear 7-step guide to putting all those principles into real-world action. So, phase 1 is all about just understanding what's going on. First, you've got to name the conflict. For our situation, it's that classic tug of war, autonomy versus beneficence. Step 2, get the facts. Why is the client refusing? Do they get the risks? What's the full picture here? And 3, what are your options? What can you actually do? Can you talk with them, maybe offer the meds later, or just document the refusal? Brainstorm everything. Okay, phase 2 is where the rubber meets the road. Now you start weighing those principles. How can you honor their choice while still trying to do good? Step 5 is so important. Get help. You are not alone in this. Talk to your supervisor, bring in the rest of the healthcare team. Then, step 6, you make the call. The one that best balances the client's dignity and safety. And finally, step 7, reflect. After it's all over, think back. What did you learn? What would you do differently next time? So we have the principles, we have the playbook, but what's the real big picture takeaway here?
It's about seeing ethics as something you do, not just something you know. And this really says it all. Knowing the code of ethics isn't about memorizing rules for a test. It's about engaging in an active, ongoing process. It's about thinking critically, it's about communicating clearly, and it's about providing compassionate care every single day.
You know, in the end, this framework doesn't always hand you a single, easy answer on a silver platter. What it does, though, is empower you to ask better questions. Questions for yourself, for your client, and for your team. Because in the messy, human world of care, the most ethical path forward doesn't start with having all the answers. It starts with having the courage to ask the right questions.